action.
Hi there, I'm Kristin McKendry, and today I want to share with you a little bit about the silent killer in women. Did you know more than 200,000 women die each year from heart attacks? That's 5 times as many women as breast cancer. Everyone knows that the universal sign for a heart attack is the clutching of the chest or saying, "I feel like an elephant is sitting on my chest." But that's not the case in women. Women present with atypical signs and symptoms than that of their male counterpart. 1 in 4 women die from heart disease. An estimated 44 million women in the United States are affected by cardiovascular disease. I have worked in pre-hospital care as an EMT. I've worked in the emergency room of a specialty hospital for chest pain. And now I work in a cardiovascular specific care facility as a pharmacy specialist. Not only am I a healthcare professional, but I'm also a cardiovascular patient. 3 years ago, I was sitting at home doing nothing when my heart suddenly went out of rhythm. I was an active female, did not smoke. At the time, I was sitting at home reading a book, and my heart all of a sudden went up to 288 beats per minute. I had to go to the hospital to have it stopped. So now, for the rest of my life, I will have to see a cardiovascular doctor to confirm that my heart is in rhythm and is healthy, as well as I have had to make some life changes. I want to show you some points that most women will ignore having fatigue. Most women are incredibly busy. They'll brush it off. They think they are too young to have anything wrong. Or they believe that heart disease runs in their family and there's nothing they can do to prevent what will happen. So, women will go to the doctor with non-specific symptoms or subtle symptoms such as indigestion or having flu-like symptoms. They think that a strained muscle in their upper back or chest has happened, and that's why they're feeling that pain. They may have discomfort in their jaws or in their upper arms. Some women will have prolonged and excessive fatigue with no explanation for why this has happened. These are signs and symptoms that most women will ignore, brush off as something else, will try to rest, will try to put a heating pad or just take over-the-counter ibuprofen for. The American Heart Association recommends that you start having your cholesterol checked at age 20 or earlier. Heart disease doesn't care if you run marathons or if you're active. Factors like cholesterol, eating habits, and smoking can affect all of your healthy habits. Especially in younger women, the combination of birth control pills and smoking increases your heart risk by a whopping 20%. When I was 20 years old, I was working in the emergency room and I saw a 22-year-old female brought in for having a heart attack. She was taking birth control pills, she smoked, she also was drinking the Monster energy drinks and was also taking an over-the-counter weight loss pill. Those 4 things in combination with each other elevated her heart rate so much that it ended up actually causing her to have a heart attack. She had no idea, happened to be out with some friends, and just kept having this burning sensation in her upper back. Her friends finally convinced her it wasn't going away and it wasn't normal, and they called 911, and she ended up having a heart attack at 22. So her life was forever changed just from 4 things that a lot of people will innocently take. Women with a family risk of heart disease are at a higher risk, but there's plenty you can do to reduce it. You can know your risk factors, be aware of your blood pressure and cholesterol. Exercise regularly and avoid smoking to decrease the risk of heart attack. Above all, listen to your body. If something isn't right, talk to your doctor. Don't just put it off. Also, before you pass off jaw pain as just sleeping funny or fatigue as something rest can fix, learn the signs and symptoms. Do not ignore them. Women have a lifetime higher risk of stroke than men. Don't think just because you work out or you are young, you are exempt from having heart disease. In African American women ages 20 and older, 48.3% have cardiovascular disease. Yet only 14% of these people believe cardiovascular disease is their greatest health problem. And I would estimate to say out of those 48.3%, only half of them realize that they might have high blood pressure or high cholesterol. Also, 80% of heart disease and stroke events may be prevented by lifestyle changes and education. So while the clutching of the chest and saying I feel like an elephant is sitting on my chest are universal signs for having a heart attack, in women these are not always the case. So you have to be diligent and mindful to know your signs and symptoms to take the chance to save a life. Because of knowing the signs, more than 6,700,000 women have been saved from heart disease, and 300 fewer are dying per day. Organizations such as Go Red for Women are a huge advocate for awareness. Think of this every time you see a red dress for women. Red Dress Awareness Month is in February. So think of that. Valentine's Day, Heart Awareness Month. Thank you and have a great day.